Thank you again, everybody, for joining us. I'm Eye Doctor Mike. Today we're going to talk about STYES, or those little bumps on your eyelids that are quite hard to make go away. I'm going to explain what they are, why they're there, and a few ways to get rid of them pretty quickly. As always, thank you again for joining, and please, if you do like eye-related content, hit that subscribe button. Now, there's a lot of things that can cause bumps or growths on the eyelids, but the two major causes that people call STYES on a day-to-day basis are hordeolums, which are infectious, and chalazions, which are a blocked gland. Let me explain the difference. If you think of the anatomy of the eyelid, we have little follicles, which are our eyelash follicles, and we have little glands called meibomian glands that secrete an oil. We have bacteria that lives all over our eyes and all over our skin. I know it's kind of weird to think about, but they're there. And they can infect either the eyelash follicle or the gland itself. This is what we call a hordeolum. Sometimes, as they develop, you can even see a whitehead on the top of the hordeolum, but please do not pop it. I know it is very, very tempting, but you should not pop anything along your eyelashes or your eyelids. It can cause even worse of an infection. It can cause scarring. It's just not a good idea, so please don't do that. Now, in terms of a hordeolum, this is generally an infection of the actual follicle or the gland itself. With that said, your body has its own natural mechanisms, so over time, there's a potential that it'll go away by itself. Now, most people want it to go away a little quicker. Let me explain a few things you can do. But first, I want to explain what a chalazion is. This is a non-infectious bump on your lid. A chalazion is a blocked gland. Now, along our eyelids, we have these little glands called meibomian glands. When we blink, it secretes an oil as part of our tears and stops our tears from evaporating so quickly. Now, what happens when those glands get blocked up? Think about a hose that is throwing water out. If you stop the hose at one end, it backs up. And that's what happens with our eyelids. They secrete the oil where our eyelashes are, but if those oil glands get blocked up, it backs up into our eyelids and you get those little hard bumps. Now, whenever you get a bump on your eyelid, it is always essential to see your eye doctor or your healthcare practitioner. The reason for this is not all bumps are the same. In this video, we generalize to a hordeolum versus a chalazion, but at the end of the day, you don't want it to be anything serious, and the only way to actually get it diagnosed is to see your doctor. They will be able to tell what it is, why it's there, and how to fix it the quickest. So don't hesitate to see your doctors. Now, in terms of the appearance, the hordeolums or the infections, you'll see the bump potentially with a little bit of white, as mentioned before. It will look a little bit more irritated. It'll be a little bit more irritating to the patient themselves. When you touch it, it could be painful. Whereas for a chalazion, it's more of a harder mass, and it's a little bit bigger for the most part and can go from the top of the eyelid all the way to where the actual eyelashes are. But with that said, sometimes they're a little confusing, and it's hard to tell without looking with a proper microscope or a slit lamp, as you see behind me, because some people will see it and classify it as a stye, but it could either be a chalazion, a hordeolum, or something else. So it's always good to see your doctor to classify it properly and treat it accordingly. Now, how do we get rid of these things? I know most of the time they come at the worst times. You have a wedding, you have an event that you're going to, and you have this bump on your lid. So number one, we recommend a heat compress. Now, I know a lot of people use either a tea bag or a hot towel. Now, in terms of a hot towel, though it may help, at the end of the day, we need about 5 to 10 minutes of heat on the actual lid and the glands to start to unblock the gland itself. With a warm towel, at the end of the day, it goes cold pretty quickly. What we do recommend is a heat mask. These are specialized masks that are made for the eyes that you can put in the microwave, wrap around your closed eyelids, and allow the heat to actually express those glands, or at least liquefy the actual oils that are getting blocked up. Number two, keeping the eyelid as clean as possible. Now, we don't want you irritating it. We don't want you touching the lids with your hands, because that can introduce even more bacteria. There are specialized lid wipes that can be used along your eyelash and your eyelash margins to help keep that area clean. Those two things, the heat mask as well as the lid wipes, are two of the most essential things to do when you have a stye, a hordeolum, a chalazion, to help your body get rid of that and fix it as soon as possible. Now, the third thing are antibiotics. Depending on the situation, your doctor will be able to examine the eyelid, examine the blockage, whether it's an infection, whether it's a blocked meibomian gland, and be able to assess appropriately. Sometimes they may give you an ointment, which is an antibiotic ointment that you can apply to your actual lids if there's any open sores or anything like that. In addition, they may give you oral antibiotics to try to help make the situation get a little better a little quicker. With that said, though people think antibiotics fix a lot of things, in this case sometimes it does nothing. So for example, in a case of a chalazion where it's a blocked gland, antibiotics won't really help. But sometimes doctors may prescribe an antibiotic that has an anti-inflammatory property to it, which will allow those glands to start to open up a little bit and potentially unblock the cloggage that is happening on your glands. So it's very worth it to see your doctors because they can prescribe the most appropriate antibiotic or none at all if it's necessary. Now, the fourth thing is surgical procedure. Some styes stay and they just don't go away. If you notice that there is a stye that is just sticking and it's not going away no matter what you do, your doctor may have to refer you to a specialist that can actually do a surgical procedure to release those glands, okay? But that's not something we necessarily go to as a primary thing. We want to try to get rid of it the natural way because with any type of surgeries, there's scarring that can exist. At the end of the day though, see your doctors because they will let you know what the most appropriate treatment is. As always, thank you all for watching. I appreciate everything you guys do, all your support. If you learned something from this video, please hit the like button. I more than appreciate it. And as I mentioned, please do subscribe if you like eye-related content. Whether you're a student, whether you work in the industry, or you just like the eyes. Stay tuned for more, and thank you again for watching. And as always, you only have two eyes. Make sure you take care of them.